finally I'm coming on the clinical evaluation. The most important, just a second, the most important is clinical evaluation. Ultra important. How? If I'm having a suspicion, if the patient is presenting, I'm ophthalmologist suppose, and a patient is presenting with a watering eye, what clinical evaluation I'm going to do? I'm going to do 7 tests. Learn the clinical evaluation. It's ultra important for your MCQs. So there are 7 tests for the watering eye. What are the 7 tests? Can we revise quickly? I mean, can we study it quickly one by one? So let's do the ocular examination. Do complete ocular examination, diffuse illumination with magnification, complete ocular examination to see the lids, conjunctiva, cornea, sclera, anterior chamber, uveal tract, examine everything. There can be disease anywhere. So first of all, try to find out the disease that is leading to hyperlacrimation. Number 1. Number 2, do a fluorescent dye disappearance test. It is known as FDDT. What is the full form? Fluorescent dye disappearance test. Fluorescent dye disappearance test, FDDT. See the full form, FDDT. So we have to do this test. What is the procedure? Now in all of these tests, okay, I will teach you two things. The procedure and interpretation. In each of them, the procedure and interpretation. So what's the procedure? What's the procedure? Install 2 drops of fluorescent dye in both conjunctival sac. Can you see in both, right, left? In both conjunctival sac, you can say, suppose this is fluorescent dye. So install 2 drops here, 2 drops here in the lower conjunctival sac. So suppose I'm having watering eye. Suppose I'm having and observe after 2 minutes. Observe after 2 minutes. If no dye, after 2 minutes, if there is no dye in the conjunctival sac, it's normal. But if after 2 minutes, there is retention of the dye, okay, so it indicates adequate drainage. Can you understand what I'm saying? Can you see the yellowish retention of the dye over here after 2 minutes? Can you see? Now this dye is yellow color. So I'm taking this dye, I'm putting 2 drops here, 2 drops here, and starting the stopwatch. Now after 2 minutes, I will see the eye. If my drainage is normal, can you see? If the drainage is adequate, whatever dye you are putting here, it will get drained in 2 minutes. And new tears will come. So the yellow color you are putting here, in the next 2 minutes, it will get drained. And the new fresh tears will come. So after 2 minutes, it should not retain. The yellow color should disappear if the drainage is normal. But if there is obstruction at any level, at puncta level, canaliculi level, sac level, or duct level, if there is obstruction at any level, so drainage will not be adequate. Okay, it's partial or complete obstruction. So even after 2 minutes, the yellowish color can be seen. So it's a simple test that shows there is problem in the drainage. There is problem. So it's Epiphora. So there are 2 types of watering eye. You understood watering eye? Watering eye is of 2 types. In every time you have to say in every test, is it hyperlacrimation or is it Epiphora? Hyperlacrimation, there is problem in the gland. There is increased synthesis. And Epiphora, there is problem in the drainage, lacrimal drainage system. So there is decreased drainage. So you have to say, is it Epiphora or is it hyperlacrimation in every test? So the first test I'm teaching you here, the first we have done is the ocular examination. After that, we are doing fluorescent dye disappearance test, in which I'm taking a fluorescent dye. See, this is a fluorescent dye. And I'm installing 2 drops here, 2 drops here. And just after 2 minutes after the installation, at the time of installation, I'm starting the stopwatch and doing an alarm for the 2 minutes. After 2 minutes, when there is an alarm, I'm just observing the eye. If there is any dye, the yellow color dye is retained there. Normally in 2 minutes, it gets drained, and the fresh tears come. So whatever dye you are putting here, the yellow color dye, in the next 2 minutes, it gets drained and the fresh tears will come. So after 2 minutes, it should not retain. But if there is an obstruction at any level of the drainage, so even after 2 minutes, you can see the dye. Appreciate the yellow color here. Appreciate the yellow color here. So interpretation, if there is no dye after 2 minutes, it's normal. If after 2 minutes, there is retention of the dye, it indicates inadequate drainage. So that's the interpretation. So I hope, so it is indicating there is a problem, inadequate drainage. There is obstruction at one of the levels. But which level, we don't know. So this test is indicating the fluorescent dye disappearance test. This test is indicating the cause of watering eye is Epiphora, but at which level we are not sure. So this is a test to indicate that. I hope you got it. The next test, the third test, is regurgitation test. It's a very simple test. What's the procedure? Apply a pressure over the lacrimal sac. Where is my lacrimal sac? Here is my lacrimal sac. You can see closely. Okay, here is my lacrimal sac. Okay, you can feel it. Here we are having the lacrimal sac. Okay, so here the lacrimal sac, a pressure is put. A pressure from down to above. A pressure is put. If any retention in the lacrimal sac, it will regurgitate from the canaliculi. And observe for the regurgitation. We are getting it. So we are putting a pressure over here. We are putting a pressure over the lacrimal sac. See the location of the lacrimal sac. You can do a pressure on your own. So do the pressure like that. So if we are putting the pressure, you can see, suppose we are putting the pressure over here. This is lacrimal sac. I'm putting the pressure over here. If pus is accumulating inside it, Okay, if pus is accumulated inside it, there is inflammation in the sac, and it will regurgitate here from the canaliculi, from these two puncta. The pus will regurgitate. Can you see the pus? On applying the pressure, the pus is regurgitating. So it is indicating the obstruction is at the level of the sac. There is inflammation in the sac. That is known as dacryocystitis. If mucopurulent discharge is regurgitating, that indicates chronic dacryocystitis. Chronic dacryocystitis means inflammation of the lacrimal sac. So there is obstruction at the level of the sac. Obstruction at the level of the sac or beyond. So that indicates that. So what this test is indicating, the regurgitation test, the cause of the watering eye is obstruction at the level of sac or duct. Because when I'm putting the pressure on the sac or duct, it's regurgitating. So there is accumulation of the pus or tears in that. So, it is regurgitating. This is regurgitation test. So in every test, you must know what does it indicate. What does FDDT indicate? FDDT indicate there is obstruction at some level, but which level we don't know. FDDT. Okay, and regurgitation test indicate there is obstruction at the level of lacrimal sac or nasolacrimal duct. Okay, it is indicating, it is more precise as compared to FDDT. Now coming on the next test, the fourth test, lacrimal syringing test. Very important, lacrimal syringing test. So what we are doing, we are putting, it is done in topical anesthesia. First, put few drops. Suppose this is anesthesia, I am putting anesthesia. So it is topical anesthesia, we use 4% xylocaine. Now we will take a cannula. We will take a cannula and insert in the lower punctum. Where is the lower punctum? Can you see the lower punctum? This is the lower punctum. Okay, this is upper puncta, this is lower puncta. Lower puncta is the lower hole. So in the lower hole, I am inserting a cannula. I'm inserting a cannula, okay, and I am injecting the saline. I am injecting the normal saline. I'm injecting with a syringe. I don't have a syringe. I don't know where is my syringe. So suppose this is a syringe. I'm injecting the saline with the cannula. The cannula is inserted in the lower punctum. So we can see the two punctum. If you see closely in the mirror, you can see your two punctum. So not in the upper punctum. In the lower punctum, you inject the cannula. You inject the cannula and it contains the syringe. It's a syringe with a needle, with a thick needle. That needle I'm saying the cannula. So basically the needle, you don't inject. You just put the needle in the lower punctum and inject the saline in that. Inject the saline in that. So what should be the flow? Use your common sense and just observe for the flow from the nose. Okay, so if everything is open, you are putting saline from here. If everything, there is no obstruction, the free flow of the saline from the nose. So if you are injecting in my lower punctum, if you are injecting the saline over here, there should be a free flow. Sorry, just a second. There should be a free flow from my nose. Okay, there should be a free flow from that particular side. If you are injecting this side nose. If you are injecting this side nose. Okay, if you are installing, not injecting. So free flow. If free flow is there is no obstruction. But if while putting the saline, if you are putting the saline with pressure, you feel a resistance. The saline is going with some resistance. So there is partial obstruction at some level. Which level we don't know, but there is partial obstruction. And if no fluid is passing, if we're not putting the pressure, the saline is not going inside. So there is complete obstruction. There is complete obstruction and it is regurgitating in case of complete obstruction. I hope you are getting it. So we are putting saline from here. There are three options. There will be three possibilities. Either it will free flow if there is no obstruction. Saline is going with resistance, with some resistance. So there is partial obstruction at some level. And saline is not going at all. Whatever you are injecting, either it is coming from the opposite puncta or from the same puncta. So there is complete obstruction. If it is coming from the same puncta, there is obstruction in the same canaliculi. If it is coming from the opposite puncta, so there is obstruction in the common canaliculi. I hope you are getting it. So the same thing is written. If it is coming from the same puncta, there is obstruction in the same canaliculi. If it is coming from the opposite puncta, so there is obstruction either in the common canaliculi or sac or nasolacrimal duct. I hope you got it. So this test is, you can understand, this test is known as syringing test. It is known as lacrimal syringing test. Lacrimal syringing test. Okay, lacrimal syringing test. So we are taking a syringe containing normal saline in that with a cannula ahead. We are injecting in the lower punctum. We are injecting in the lower punctum and putting the saline. If saline is going freely and coming from the nose freely, so there is no obstruction. If it is going with a resistance but coming from the nose, so there is partial obstruction somewhere. But if it is not going at all and regurgitating from the puncta, same puncta or opposite puncta, so it indicates complete obstruction. So this is syringing test. Okay, so what we are doing again, we are putting normal saline from the lower puncta and seeing for the flow. If it is free flow, there is no obstruction. If the saline is going with a resistance, there is partial obstruction. If it is not going at all and coming back, regurgitating, whatever you are injecting, it's regurgitating from the same puncta or opposite puncta. So it indicates complete obstruction. So that is lacrimal syringing test. So we have done 3 tests till now. Okay, fluorescent dye disappearance test, regurgitation test, and lacrimal syringing test. Okay, now the next test. These 3 tests are showing that there is some obstruction in the drainage system, in the drainage pathway, but they don't show the exact location. Okay, now none of the tests we have done for hyperlacrimation. Now the next test, Jones dye test. So next test we are doing is the Jones dye test. Please understand it's tricky. Jones dye test. Okay, it will differ. There are 2 type of Jones dye test. Jones dye test type 1 and type 2. I mean primary Jones dye test and secondary Jones dye test. One by one we will do. Let's first do the primary Jones test. Jones primary test. So it will differentiate the hypersecretion from the partial obstruction. It will differentiate hypersecretion from the obstruction. Is it hyperlacrimation or the partial obstruction? The problem is in the gland or the problem is in the drainage. It will differentiate that. The first test, the primary Jones test. Okay, so either the problem is in the gland, it is synthesizing more, or the problem is in the drainage pathway, it is obstructed. So it will differentiate. In both of them, there is accumulation of tear that will lead to watering eye. So if the patient is coming to me, doctor, I'm having watering eye. Constantly tears are coming out of my eye. So my patient is having watering eye. Either the lacrimal gland is defective, it's overfunctional, or the drainage pathway is defective, it's underfunctional. So I will apply primary Jones dye test. So what I will do? I will install 2 drops of fluorescent dye. And I will put a cotton bud in the inferior meatus of the nose. Can you see a cotton bud in the inferior meatus of the nose? And I will wait for 5 minutes. After 5 minutes, I will see the dye on the cotton bud, whether the dye is coming on the cotton bud via nose. Yes or no? Okay, what is the normal passage? Normal passage, first of all, there are puncta. Then puncta lead to canaliculi. Canaliculi lead to sac, nasolacrimal sac, and it lead to nasolacrimal duct. Okay, this is the normal passage if it is open, completely open, if it is open. So whatever dye we are putting here, few drops, they will go in the puncta, they will go in the canaliculi, they will go in the sac, and from the sac, they will come in the duct, and they will stain the cotton bud we are putting here. So there is a cotton bud. Have you seen a cotton bud? Suppose this is my cotton bud. So we are putting the cotton bud. Suppose this is a fluorescent dye. So I'm taking the fluorescent dye, I'm installing few drops here, the yellow color dye, and I'm putting the cotton bud over here in the nose. Okay, in the inferior meatus of the nose, deep inside in the inferior meatus of the nose. So let's see whether whatever I have installed here, whether the free passage is there and it is coloring this cotton bud. So that is the principle. Okay, so this is the procedure. You don't have to learn, you have to understand. So you have to install 2 drops of fluorescent eye in the conjunctival sac, and you have to take a cotton bud. You have to put the cotton bud in the nose, in the inferior meatus. So suppose I am installing here, I have to put the cotton bud in the nose, deep inside in the inferior meatus, and wait for 5 minutes. After 5 minutes, I will take the cotton bud out and look whether it is colored or not. Okay, I will look for the dye on the cotton bud. Okay, now there are 2 possibilities. Either it will be stained or unstained. If it is stained, it is positive test. If it is unstained, it is negative test. You can see here it is stained, here it is unstained. If it is stained, okay, the cause of watering eye is hypersecretion. Okay, I mean the passage is normal, it is stained. So why the watering eye is there? The problem is in the gland. The gland is producing more and more tears, but there is no obstruction in the passage because clean passage is there. The cotton bud is colored. I mean it is stained. And if it is unstained, so the gland is producing normal tears, but there is obstruction either in the puncta or in the canaliculi or in the sac or in the duct. We don't know the exact location, but there is some problem in the drainage. Okay, so the cause is the epiphora. So if it is stained, the cause is the hyperlacrimation. If it is unstained, the cause is the epiphora. I hope you got the basic principle and the interpretation. I hope you got the principle, procedure, and interpretation. Got it? So basically, Jones' primary test is differentiating hyperlacrimation from the epiphora. So suppose I'm a patient, I'm coming to you, you are an ophthalmologist, doctor, I'm having watering eye, this eye, I'm having tears. You say, ma'am, don't worry, there can be 2 problems. Either there can be one of the 2 problems. Either your gland is defective, it is producing more tear, or your drainage is obstructed. That gland is normal, but the drainage is obstructed. So whatever tears are formed, they are not drained properly. So let's perform Jones primary test. So take a fluorescent dye, install few drops in my conjunctival sac, okay, and take a cotton bud and put it inside in the deep meatus and wait for 5 minutes. After 5 minutes, just take the cotton bud and see whether it is stained with the dye which you have put here, yes or no. If it is stained, I mean the passage is normal, but still the passage is normal, there is no obstruction in the passage, in the drainage, but I'm having the watering eye. So the cause is the gland. The gland is doing hypersecretion. Okay, number 1. Okay, and if it is unstained, so there is problem in the passage. Either the puncta or canaliculi or sac or nasolacrimal duct, one of them is obstructed, and that's why it is not stained. So this is how we are differentiating the hyperlacrimation versus epiphora from Jones primary test. Jones test, the primary Jones test, the primary Jones test. Now I want to differentiate whether if it is Epiphora, if it is negative, this test is positive, so it's hyperlacrimation. This test is negative, it's Epiphora. If it is Epiphora, if this test is negative, then is the cause physiological or mechanical obstruction? I mean, there is problem in the pump, lacrimal pump. Physiological means lacrimal pump because of orbicularis muscle. Is it the cause is this or this? So for that we apply Jones test too. That is secondary Jones test. Okay, secondary Jones test. So secondary Jones test is applied only if the primary is negative. That is the cause is Epiphora. Now you want to differentiate which type of Epiphora. Is it due to lacrimal pump failure, that is physiological, or is it mechanical obstruction? Okay, you want to differentiate the two. So if the primary test is negative, then apply the secondary test. So again, what we are doing, it is the same. I mean, put the cotton bud again. Put the cotton bud here again. But you are syringing. You are syringing. You are syringing over there. You do the lacrimal syringing. I taught you, na, in the lower punctum, you put a syringe and just inject the saline with pressure. Saline with pressure. Okay. Now, if there is partial obstruction anywhere, initially it was unstained because of the partial obstruction. But if you give a pressure from behind, the partial obstruction overcome and the cotton bud will be stained. So it is indicating partial obstruction. If it is stained now, initially it was unstained, but now if it is stained. But still, if it is now, even after doing so, if it is unstained, so the cause is lacrimal pump failure. So what you have to do? You have to put the cotton bud again. You have to put the cotton bud again and now do the syringing. Do the syringing. Do the syringing. Okay, now if it is positive this time, so it indicates partial obstruction at any level, puncta, canaliculi, sac or the duct. But still it is negative even with pressure. So the cause is the lacrimal pump failure. I hope you got it. So I'm a patient. I'm having watering eye, this side eye, or let's say this side eye. So this side eye, I'm having the watering eye. I'm having tears from the eye. You are an ophthalmologist. I'm coming to you. Doctor, I'm having watering eye. Constantly the tears overflow from my eye. Say, ma'am, you are having a watering eye. So either the cause, one of the two possibility, either the cause, your gland is defective, it is producing more tears, or your drainage is, under functional. So there is obstruction at the drainage pathway. So the tears are formed normally, but they are not drained properly. So they are accumulating and overflowing. So say, I will ask doctor how to differentiate. What is the cause? Is it hyperlacrimation or is it Epiphora? Either the gland is hyperfunctional or there is obstruction in the drainage. So ma'am, we will perform two tests. Jones primary test, Jones secondary test. So Jones primary test, you take a fluorescent dye, install few drops over here, take a cotton bud. Okay, put it in the inferior meatus deep inside and wait for 5 minutes. After 5 minutes, take the cotton bud and see whatever you have installed here, the fluorescent dye, is it staining the cotton bud? Yes or no? If it is staining, so there is free flow, so there is no problem in the drainage. The problem is in the gland. So if it is stained, the test is positive, so problem is in the gland. And if it is unstained, so there is obstruction. There is some partial obstruction at some of the level. Okay, so the test is negative, it is the cause is the Epiphora. Now, if the test is negative, we will further apply Jones secondary test. Okay, where we will differentiate the cause is Epiphora, but is it due to lacrimal pump failure or is it due to some obstruction? Okay, so again I will put the cotton. I'm not installing the drops again. The drops are already there. They are not come here, no? The drops are already there, but they have not stained the cotton bud. Okay, now I will again put the cotton bud and I will do the syringing in the lower punctum. I will put the saline with pressure and let's see now if it's staining or not. If there is partial obstruction anywhere, with pressure I am putting the saline, it will move ahead and now it will stain. Even if it is not staining with the pressure, so it indicates the lacrimal pump failure. So I hope you all got it. So what I want to differentiate here, the primary Jones test differentiate hyperlacrimation from Epiphora. So primary Jones test is positive in hyperlacrimation and negative in Epiphora. And the secondary Jones test differentiate the pump failure from the mechanical obstruction. It is positive in mechanical obstruction, partial mechanical obstruction, and is negative in the pump failure. That is the secondary Jones test. So primary Jones test differentiate hyperlacrimation from Epiphora, and secondary Jones test differentiate the pump failure from the partial obstruction. I tried my best. I hope you got the two tests. This is primary Jones test. This is secondary Jones test. The secondary Jones test is done with the syringing. We are putting the saline with the pressure. So that's the Jones test, the fifth test. Now coming on the sixth test, that is Dacryocystography. Dacryocystography known as DCG. Dacryocystography. What we are doing here, it is indicated if the cause is mechanical obstruction. It is indicated in case of Epiphora. Now you will say, ma'am, if it is Epiphora, how you are locating the exact location? What is the exact location of the obstruction? Is it punctum? Is it canaliculi? Is it lacrimal sac or nasolacrimal duct? For that, we are performing Dacryocystography. So what we are doing, we are taking a radio opaque material and we are installing it in the eye. Again, suppose this is radio opaque material. I'm installing it in the eye. I'm installing it in the eye and waiting for 5 minutes. After 5 minutes and 30 minutes, I will take two X-ray. The first X-ray I will take after 5 minutes, and second X-ray I will take 30 minutes. So I will come to know the exact location of the obstruction. I'm putting the dye over here. See. I'm putting the radio opaque material over here. If everything is open, in 30 minutes it will pass. If there is obstruction, see in this diagram, this side it is passing completely, but this side after the sec it is obstructing. It is not going further. So I came to know the exact location. I can see the dye in the X-ray. I'm doing X-ray. One after 5 minutes, one after 30 minutes. So I will come to know the exact location. So the dye is passing till what? Till what? The dye is passing into the punctum, into the canaliculi, into the sec, so I will come to the exact location. So this is dacryocystography. So in dacryocystography, we are putting a radio opaque material and taking X-ray after 5 minutes. 5 minutes and 30 minutes. We will come to know the exact location. One more test, similar test we are having. It is radionuclide dacryocystography. So it's a modified version of dacryocystography only. So here, instead of radio opaque material, we are putting radioactive tracer material like sulfur colloid or technetium, some radio tracer material. And we don't take X-ray, we use gamma camera. So procedure, the principle is same. We use gamma camera after 5 minutes and 30 minutes to see the passage of the radioactive tracer. So basically in dacryocystography, we are putting a radio opaque material. Here we are putting a radio tracer. Here after 30 minutes, we take a X-ray, and here after 5 minutes and 30 minutes. Here after 5 minutes and 30 minutes, we use a gamma camera to see the exact location of the obstruction. You can see here the exact location of the obstruction over here. Here you can see it's free passage everywhere. Here there is the exact location of the obstruction. So you can see. So this is dacryocystography. This is a modified dacryocystography, that is radionuclide radiocystography. So instead of X-ray, we use a gamma camera over here. That's it. So these are the 7 clinical evaluation, and that's all about the watering eye. In watering eye, the most important thing is the 7 clinical evaluation, and you should know the 2 etiology: hyperlacrimation and epiphora. Either the synthesis is more or the drainage is inadequate. You must be telling the causes of that. So that's all about the watering eye. So in this episode, we have completed the watering eye. Now remaining 5 diseases, the dacryocystitis and dacryoadenitis, are covered in the next episode. Please do watch that. Thank you so much.